Welcome back to the Pain Management Handbook recording. This is the 6th recording and the last one in the series. Just like with the other recordings, we'll start off by asking you to reflect on what you learned in the last session and maybe what you're going to do differently. Perhaps pause the recording to give yourself a chance to think about this. We start off in this session looking at flare-up planning. No matter how well you manage your pain, you will have times when your pain increases. These are called flare-ups. They are normal for people with chronic pain. The increase in pain can be scary, but it is normally only lasting for a short period of time. Most of the ways of managing pain shown in this handbook are about changing your habits. It is important when you have a flare-up that you do not return to the habits that do not help your pain in the long term. Things like increasing your medication and taking to bed may seem okay at the time, but will not always be helpful in the longer term. It is important to plan for when you are going to have a flare-up so you do not return to unhelpful old ways of coping with pain. Remember, what you do will make a difference to the following things: how often you have a flare-up, how long it lasts, and how severe it is. What people notice about flare-ups tends to be, firstly, that they can occur for various reasons. They can be sudden, such as after having an accident or illness, but they can also be gradual. What to do when you have a flare-up? Well, firstly, don't panic. Stop and think. Take your time before reacting. Reacting without thinking or panic can make things worse. If possible, identify the cause. Have you been overdoing things, not pacing activities effectively? Have you been setting goals that are too much? Have you had a lack of sleep? Maybe you're doing less than normal. Maybe you've been ill or have had an accident. Maybe you're stressed. It might be that there's no reason. Symptoms can sometimes change and it can be hard to know why. Things to try. Stop what you're doing and have a short break. Stretch, maybe have a walk. Replan or reprioritize your day. Take more breaks. Swap more often what you're doing. Continue your exercises. Keep active, especially stretches. You may need to do these at a slightly lower level. Concentrate on one or two of your favourite exercises to start with. Aim to return to your previous level of activity within a week. You may need to be flexible and reset your goals. Look at advice you've already read on pacing. Spend some time on breathing techniques, including diaphragmatic breathing. Maybe try the mindfulness practices. Apply heat or ice, whichever helps. Take care as they both can burn. Positive thinking. Challenge and helpful thoughts. Maybe call a friend for a chat, but try not to talk about pain. Look at advice on posture. Be sensible in how you use medication. Things to try to avoid. Continuing activity without thinking. Getting into unhelpful thinking. Taking extra medication. Or taking to your bed or the sofa. Remember, increased pain does not mean something is wrong. It is a temporary setback. Remember that you are in control. Look at how you coped when the flare-up ends. What can you learn from this flare-up? What do you like about what you did? Recognise your achievements. What could have been done better or differently? How well have you been doing with the activities and approaches in this handbook? The next page of the handbook is a flare-up plan worksheet. This worksheet is to help you plan for a flare-up. You can put it somewhere to remind you what to do if your pain stays above its usual day-to-day variations. So the idea is that you can retrieve it, and it will remind you what to do if you're having a particularly painful day. Firstly, it asks, what are the usual warning signs that the pain may increase? Have a think, record it if you like, in the way that works best for you. Things to try. Remember the diagram that we talked about earlier? I think it was back in the first or second week. It was that there is a connection between our thoughts, our feelings, our behaviour, and the physical experiences that we have. Try to improve each area of these interconnected parts. So try to improve our thoughts, our feelings, our behaviours, and also hopefully our physical responses. Consider including gentle stretches, helpful thinking, contacting friends, doing enjoyable activity, pacing more, and maybe being kinder to yourself. Some people make a first aid kit. This is a box that includes things that make them happy or prompts them to do things which make them happier. The worksheet then asks things to avoid. What habits are not so helpful? Spend some time thinking about this, as these are things to try and stick away from. The next section of the Pain Management Handbook shifts our focus to nutrition and hydration. A healthy diet is needed to keep our nervous system working well. Hydration or water intake is vital for good health in both the short and long term. Without good diet and hydration, our nervous system can become more sensitive. We can also have higher inflammation in the body. With poor diet and hydration, we can have less energy, disturbed sleep, and increased anxiety and depression. Our stress response can get bigger as well. Beneath this, there is a plate that has been broken into roughly 3/3. In 1/3, there is images of bread, rice, potatoes, and pasta, or other starchy food. In another third, there is an image of fruit and vegetables. As you might have guessed, this diagram represents the proportions we should be aiming to have from different food groups. The final third is broken up into 3 parts itself, with 2 larger thirds, which are maybe 2/5 each, and 1 smaller third, which is maybe 1/5 in size. In one of the larger thirds of this remaining third itself is meat, fish, eggs, and beans, and non-dairy sources of protein. In one of the other larger thirds is milk and dairy foods. And in the smaller third, food and drinks high in fat and/or sugar. So just to recap on this again, this diagram is recommending a third of our diet be bread, rice, potato, pasta, or other starchy foods. Another third as fruit and vegetables. That a remaining smaller proportion is taken up with meat, fish, eggs, and beans, milk and dairy foods, and a small amount of sugary foods that are also perhaps high in fat. Hydration. Water is essential for life. It helps transport nutrients in the blood, remove waste products, and acts as a lubricant and shock absorber in joints. We usually get 70 to 80% of our water needs from drinking and 20 to 30% from food. People commonly hear that we should drink 2 litres of water a day for a man, and maybe 1.6 litres of water for a woman. However, this is taken from some quite old research and should not be taken as accurate. The amount of water you need depends on your body size, the temperature, the humidity, and how much you exercise. This is also dependent on your metabolism. It is best to drink regularly and check that you are not showing the early signs of dehydration. 2 early signs of dehydration are thirst and dark-coloured urine. This is the body's way of trying to increase water intake and decrease water loss. Other symptoms may include dizziness or lightheadedness, headache or tiredness, dry mouth, lips and eyes, and passing small amounts of urine less than 3 or 4 times a day. Warm and dry environments such as air-conditioned offices or centrally heated homes increase the need for water as they speed up the evaporation of sweat on the skin. Chilling or filtering tap water are cheap ways of making it taste more pleasant. Bottled water has the same hydrating abilities as tap water. Tea and coffee provide water and can be good for keeping hydrated. However, if you drink a lot of tea and coffee, you need to be aware of the amount of caffeine you're consuming. This is particularly important for pregnant women. Fizzy and still drinks can contain a lot of sugar and should only be drunk in small amounts. Fruit juices provide water and other nutrients, but contain sugar, so only have 1 small serving per day, but this also does count towards your 5 a day. Alcohol may make the body pass more urine than usual and make you dehydrated. It is a clever idea to drink low-sugar soft drinks or water when drinking alcohol. Nutrition. Fats and oils. Inflammation can be increased by saturated fats and trans fats. These are fats that are solid at room temperature and vegetable oils processed to become solid. Examples of these are lard, butter, fat on meat, and full-fat dairy foods. Often takeaway foods and processed foods like cakes, pastries, and biscuits can be high in these fats. Check different food labels to see what they contain. Inflammation can be affected by the types of fats that you eat. Polyunsaturated fatty acids can reduce inflammation, but it is important to distinguish between the different types. Omega-3 fatty acids, which are found in oily fish, rapeseed soya, flax, linseed oils, and walnuts, can reduce inflammation. Omega-6 fatty acids are found in vegetable oils, nuts, lean meats, and eggs, and should be eaten in moderation. A high proportion of omega-6 to omega-3 ratio may increase inflammation. Carbohydrates. These tend to be our main source of energy and play an important function in the regulation of our body's sugar levels. 50% of our energy should come from carbohydrates. However, the type of carbohydrate is important. There are starchy, non-starchy, which are sugary, and dietary fiber carbohydrates. Starchy carbohydrates include flour, rice, grains and cereals, pasta, and etc. These can release energy more slowly than sugary foods and give more stable blood sugars and energy levels. Sugary foods can cause peaks and troughs in blood sugar levels, giving rise to fatigue. Proteins. Proteins are the building blocks of our body and are vital for metabolism and organ function. It is found in all types of meat, eggs, dairy, beans, lentils, nuts and seeds. Tryptophan is a protein found in food. Serotonin, a feel-good chemical, is made of tryptophan. It is thought that people who experience anxiety and depression may have lower levels of serotonin. Tryptophan is also linked to the production of melatonin, the chemical which promotes sleep. A balanced diet may improve sleep, reduce stress and anxiety, Proteins may be better absorbed if eaten with starchy carbohydrates. Vitamin and mineral deficiency. Fatigue often accompanies chronic pain, and it can be made worse by anemia and deficiencies in folic acid, vitamin B12 and vitamin D. Iron deficiency gives a condition called anemia. Anemia can also occur because of inflammation, or can be due to long-term use of non-steroidal anti-inflammatory drugs, for instance ibuprofen or naproxen, that can lead to stomach ulcers and/or internal bleeding in some people. Without vitamin D, only 10 to 15% of dietary calcium and around 60% of phosphorus are absorbed. Vitamin D deficiency can result in widespread or localized bone pain without any injury. Pain in ribs, hips, pelvis, thighs and foot pain are typical. Vitamin D and B12 deficiencies can also cause multiple weakness, muscular aches in the limbs and back and weaken bone structure. In healthy people who are eating a well-balanced diet, nutritional supplements are not necessary, however. Omega-3 fatty acids, 0.5 to 1 gram of EPA plus DHA daily may be beneficial for those with inflammatory conditions such as rheumatoid arthritis. So these are suggestions of dietary supplements for particular conditions. Magnesium, 600 milligrams may be beneficial in fibromyalgia. Vitamin D3, 600 international units daily may be beneficial in fibromyalgia. People with a proven vitamin D, iron, folic acid, and/or vitamin B12 deficiencies may be prescribed a higher dose than what is otherwise recommended. The British Association of Dietitians provides helpful fact sheets at www.bda.uk.com. That's www.bda.uk.com, of interest for people with chronic pain, so maybe check it out. Check out the fact sheets on diet and rheumatoid arthritis, diet and depression, food and mood, osteoarthritis, osteoporosis, food facts, healthy eating, alcohol and weight loss. That concludes everything from the recording of the Pain Management Programme Handbook. I hope that this recording has been useful and interesting. You may wish to discuss some of the topics raised with your clinician or with your GP. Thank you for your time. Goodbye.